Hello and welcome to this NIASW webinar entitled Social Work, Not Paperwork. It's a summary of the key points of our survey of family and childcare social workers, which we launched on the 29th of November 2012. My name is Carolyn Ewart and I'm the manager of the Northern Ireland Association of Social Workers, and we've developed this series of webinars as an extra benefit for members and to support social workers in gaining their CPD. This webinar and our next two will be available free online to all social workers, but thereafter they will be exclusively a member-only benefit. I hope that you enjoy today's webinar and we'd love to hear some feedback from you, so please take time at the end to let us know what you think. I'm also going to ask for your patience and understanding as this is my first webinar. So if I stumble or trip up, I hope that you are forgiving and allow me some time. And what I plan to do today is for the next 40 minutes talk you through the main findings of our report, Social Work, Not Paperwork. And I'll end by talking to you about our recommendations and what we, your professional association, have done so far. So, what did we do? And why did we do it? It has to be said that myself and Anne McAllister, our professional officer, and Susan Gordon, our advice and representation officer, travel widely across Northern Ireland, and we take every opportunity we can to go and meet with social work teams and social work practitioners. And one of the things that we've heard repeatedly, time and time again, has been the ongoing challenge that you face within the field of family and childcare in relation to unnecessary bureaucracy. So we decided to support our members and to support social work practice by undertaking a survey to try and establish the extent of the problem. We sent it out to directors of social work leads, first-line managers and members. So we tried to get it out as widely as we could and tried to encourage as many people within the profession to take the time to complete it as we possibly could. So who responded? We sent the survey, it was electronically available on SurveyMonkey. We decided it was necessary to have an easy to complete survey that would take a limited amount of your time. We're acutely aware of the time pressures that you face on a daily basis, so we tried to tailor something that would take about 5 to 10 minutes for you to complete. We had 149 responses in total, and I have to say we are really pleased here with the quality of the responses that we got. Those of you who took the time to fill in the survey really shared your experiences of practice. You shared the positives, you also shared some of the challenges that you have, and you took time to really comment, and we find those comments and direct quotes from you as social workers on the front line really invaluable in terms of sharing with policymakers and with the public. 132 of you were based in trust settings, 17 in voluntary settings, and the majority of you are working full-time. We decided once we started to analyse the report to try and bring forward positive messages from the survey. We didn't want, when we took it to the public, there to be criticism of social work staff with a largely negative message. So we grouped responses around 5 main themes, and they were: social workers go the extra mile, social workers want to make a difference, social workers tell it like it is, social workers value teamwork, and social workers value people. And so I'm going to spend some time talking you through the major findings in each of those categories. So first up we have social workers go the extra mile. And I have to say, I think this was our most shocking statistic. Over 2/3 of you reported that you're spending less than 30% of your working week in direct contact with children and families. 76% of you reported regularly working extra hours, and 50% of you report that extra hours you work amount to 20 to 60 hours every month. I mean, this is equivalent, if you stop and think about it, to working an extra week every single month of the year, and you're doing it all unpaid. And that's a really important message for us to take back to your employers and to policymakers in terms of looking at the staff quotas within teams. I mean, if you imagine within your teams, if there are 4 of you working within a team and each of you is doing an extra week unpaid, that actually adds up to an extra whole-time equivalent social worker needed within your teams. So it's really important that you as practitioners are recording your toil, that you're making sure that your managers are aware of the amount of extra hours that you're working, and they and them can in turn use that information to argue for extra staff. Please let us know as well as your professional association if that's a routine and common occurrence, and we will make sure that that's highlighted on your behalf. As I mentioned earlier, we find it particularly useful to have direct quotes from you, from practitioners, and to hear about people's experiences. And if you look through the report in detail, you'll see there are a substantial number of quotes, and we've just picked one out here. And I think it's one that will probably resonate with a lot of you. One person says, "I mean, nobody is doing their 37.5 hours. Everybody, every week, is doing so much more than that. It could be 10 hours, it could be 20 or 30, and everybody's the same." And that's really stark. It's a stark quote that is what practice is like for you on a daily basis. It's very typical, I have to say, of what we heard. Another quote we had was, "It's an unspoken rule in family and childcare that you will work after 5. It's just expected." If we move on then to look at our second category, which was that social workers want to make a difference. You told us that there were 3 key things which prevented you from spending time with families, and it was report writing, recording on client files, and entering information onto a computer system. 96% of you, actually reported report writing to be a significant block to you spending time with children and families. 90% reported recording on files as a block, and 73% of you entering information onto computer systems. And it's really important that we make sure that this message is taken forward on your behalf. We as the professional association absolutely and categorically accept that paperwork is essential and it's necessary. It's the cornerstone of good social work practice that good quality assessments are carried out and they're accurately and timely recorded. However, I think what our survey highlights and the message we've tried to take forward on your behalf is that at the moment the system is disproportionate and it's unbalanced. You are simply having to spend completely too much time on paperwork, and you have insufficient time to spend working with children and families. We also wanted to highlight within the survey examples of good practice, and I was really delighted to be able to spend time with Linda McConnell from the Southeastern Trust. Linda is the Children's Services Improvement Manager, and she was sharing her experiences and a piece of work that she'd been involved in with the Ards Gateway team. I have to say Linda was a real inspiration to spend time with. She was so enthusiastic about what she was doing and the work that she'd been able to undertake with the Ards Gateway team, and she was full of praise for the social workers and the administration staff within that team who were prepared to work with her to make the changes that were necessary. Within the Ards Gateway team, they identified a problem. There were a high number of unallocated cases. Social work staff were spending too much time inputting data into computers and spending too much time on administration tasks. They were unable to address the backlog of unallocated cases, so the waiting list for access to the social work team was continuing to grow and grow. So the team got together, they identified this is the problem and set about identifying aims. Their overall aim was to reduce their unallocated cases by 50% within 6 months. They also wanted to be able to reduce the time that social workers were spending on admin tasks. So what did they do? They had a complete review of who was doing what within the team, and they were able to identify that actually the people most skilled and trained to input information into computers and to be responsible for the administration tasks were in fact the administration staff. So they set about enabling that to happen. They also developed a new template for recording at the point of referral, which was then immediately passed to the admin staff within the team to put onto the computer system at that point. They also streamlined social work recording of assessment, and they implemented an electronic file. So they didn't need any additional resources, they didn't need any additional staff, but what they did were make very substantial changes to how the team worked. So what did they achieve? They actually achieved 100% reduction in unallocated cases. They were able to make significant savings in the time spent on administration tasks, and more than that, they were able to save 6 hours and 36 minutes of social work time, and they also had it reported increased job satisfaction and perception of safety for social workers, both from social work staff and from administration tasks. It now takes within the team, the administration staff, 18 minutes to record the necessary information on computer. And it's an excellent example of how a team worked together to identify a problem and ensure that each member of the team was involved in doing the task that they were most skilled and trained for. And what they've achieved are significantly better outcomes for all of the staff involved, but most importantly for the children and families who were waiting for a service. So social workers tell it like it is. We asked you about the factors that impact on your time that you have available to spend with clients. And you told us that 87% of you struggle to spend time with your clients because of dealing with unplanned crises. Now, as social workers yourselves, I don't need to tell you what unplanned crises are like within a social work team, but we did take time within the report to detail what unplanned crises might look like, so that for people outside of the social work background, they got some insight to some of the situations that you might have to deal with. And those, for example, could be a placement breakdown, an allegation of abuse, an emergency reception into care. And I think for people to have some understanding of the complex and very high-risk situations that you're working with on a daily basis is helpful in terms of understanding what it is that social workers do. All of those situations need a very skilled response from a trained and qualified social worker. And it was important that we were able to get that message across on your behalf. 79% of you feel that you spend too much time in telephone contact with other agencies. I think whilst recognising that obviously communication and sharing information is essential, it was certainly highlighted as a factor which impacted on you. 78% of you identified travel time as a factor which also impacted on your time. We had lots of additional comments as well in terms of reports that compiling statistics, attending meetings, arranging meetings, and also the whole issue of contact was raised as one which has a huge impact on your time as well, whether that's transporting for contact, actually setting up contact, or supervising contact. So it's something that we've taken forward and made a recommendation in relation to that. You also highlighted within the report, within your responses, that social workers value teamwork. That was incredibly clear. There were lots of really positive comments and quotes from yourselves about the benefit and the need for teamwork, particularly in working with your admin team colleagues. 34% of you highlighted the need for really good, high-quality admin support within a team. It was very worrying that actually there were a number of you reporting that you had no administration support within your team at all. And we've certainly raised that with policymakers and with your employers. We know that the review of public administration had a significant impact on the number of admin staff within the team, but it's unacceptable that you don't have those valuable members of team helping you and support your work. You also reported the need for less report writing and a significant number of quotes around duplication of paperwork and how frustrating and time consuming that is, particularly in relation to looked after children documentation and Unitini forms. And I think what you were able to say was that, the forms in essence are good forms, but actually, in particular in relation to the Unitini forms, the idea in terms of how the Unitini form was developed, that the forms would come to childcare with significant amounts of information already completed. What we're hearing is that that's not happening, and they've become largely forms for social workers to complete. You also identified the need for improved IT. I mean, it was a very clear message that actually your IT needs are not being met. We have examples of one team where there was, one computer between 18 staff. Some of you don't have mobile phones, and certainly access to appropriate IT at the time you need it was highlighted time and time again. Rather controversially, a lot of you suggested that you wanted to have access to your computers at home so that you could get caught up on paperwork at home. And I think whilst we know that's a practice that happens, we don't support it in so much as it's about trying to get some time away from work. We don't want there to be a system where you feel that it's a duty to take paperwork home. It impacts on your family life and your work-life balance, and it adds to stress in an already stressful, difficult job. I remember that dreaded briefcase sitting in the corner, with that need, I must do recording, I must get that file done, and it's something that we wanted to step away from. You also told us very, very clearly, 94% of you want to spend more time with children and families. You value people. It was why you came into social work. It's what you trained for, and it's what you want to spend your time doing. You want to make a difference. You want to help people make positive changes in their life, and you don't want to be stuck behind a desk, filling in forms, time and time again, duplicating information, forever recording on client files. And so what we've said very clearly on your behalf is that social workers want to do social work, not paperwork. We as your professional association argue strongly on your behalf that it's indeed what you should be doing. We want to make sure that your skills and your experience and your knowledge are acknowledged, and that they're being used in the right place and in the right way. So moving on to our recommendations, obviously we tried to distill the information from the report, and we've made 9 key recommendations. A number of them, as you'll see when we go through, actually are directed towards the Department of Health, Social Services and Public Safety. And in particular, we've targeted, or we've aimed them at the department because of the department's 10-year strategy for social work. And we acknowledge that it may well be the vehicle for delivering on lots of the recommendations that we make. I have to say we want to commend the department for leading the UK on this. We are the first part of the UK to have a social work strategy, and certainly as someone who works in a UK-wide organisation, I take up every opportunity I can to highlight when Northern Ireland leads the way in a positive way. So it's something I've been able to do. One of the things we identified was that we, as your professional association, need to explore ways in terms of we need to do further research to look at areas where additional overtime is required within the family and childcare field. We've also recommended, because of the messages that you gave us in the report, that employers need to look at the caseload rating system. We're aware that there's a very good caseload rating system there, but it's in use regionally. What we're saying is that that system needs to be audited, and there needs to be a thorough and comprehensive and consistent use of the caseload rating system across Northern Ireland. As I mentioned earlier, we made recommendations aimed at the department, and one is that they should lead a review of recording requirements. We have already met with the department on the 18th of December to discuss this survey as well as other issues, and we had a meeting yesterday with the Minister for Health, Edwin Poots, who I have to say was incredibly receptive to to our suggestions on ways that we can in fact cut back the recording that you're required to do. So I'm very positive that that's something he wants to take forward, and we will be more than happy to be involved in working on that with the department. Given the amount of feedback we had about the important role of administration staff and teamwork, we make a recommendation that employers need to make sure that every social work team has administration staff available. And we will continue to push that message and to talk to the directors about it when we meet them over the coming weeks and months. We also, based on your reports, have recommended that the Health and Social Care Board should commission a review on child contact arrangements. We have written to and requested a meeting with Fiona McAndrew, the director of the board, and specifically we want to be discussing that recommendation. We're aware that there are a whole variety of practices across Northern Ireland, and again what we'd like to see is some consistency around the availability of contact centres, contact workers, social work assistants or support workers in terms of supporting contact arrangements. I think it's also something that needs to be addressed with the court system in terms of a lot of the contact arrangements that you were reporting to us are court directed, so there's obviously work to be taken on there. I'm sorry folks, I've just realised that I forgot to press my little button, so you've been looking at a blank screen for the last few moments. Apologies for that. I'll give you a minute or two there just to read through those recommendations, but they're all available in our report. Our sixth recommendation again was exploring the issue around reducing bureaucracy, and very much I think that's as part of the 10-year strategy. The department, as I say, produced a strategy last April. At this point in time they have established the social work steering group, the group who will oversee how that piece of work goes forward, and certainly NIASW will be requesting to be a part of that. We also recommend that the department really should explore the use of IT, and again as part of the strategy I think you give us a very clear message that there are so many IT tools available that could make a real difference to your daily working lives, could help you save time and therefore help improve the services that children and families receive. So it's an area that requires ongoing work. Again, based on your findings, it was very clear that duplication and recording is a key issue. So one of our recommendations is that the board should lead on ways to reduce duplication. We're aware that the RIT teams are continuing to look at this issue, and one of the work streams of RIT is currently looking at reviewing the LAC forms. And I suppose we would encourage that, support that, and ask that in reviewing that documentation that the people involved keep in mind the need to actually reduce the amount of paperwork that youth practitioners have to complete. If recommendations are being made about forms and changing forms which will rely on the use of IT and computers, it's important that people involved in looking at that work are aware that not a lot of you actually have access to the right IT equipment to do that. We also want the department to identify good practice. One of the reasons why we had our case study, and we were able to highlight that case study yesterday in our meeting with the Minister, who was particularly interested to hear about the work that's been undertaken within the South Eastern Health and Social Care Trust. So what have we done? I mean, it's very clear from this report that you as social workers are highly committed to the job that you do. You're going the extra mile, you're working above and beyond the call of duty, you're certainly working above your contracted hours for no pay. But actually it's a message that you're a professional who's under extreme pressure, and it's time that we made a change to that. So we have requested a formal hearing at the Assembly Health Committee, and we're waiting to hear back about that. We have written to each political party and requested again a meeting with them to discuss or report and other issues that are pertinent to social work. We are and will continue to challenge and encourage the department, the Health and Social Care Board and employers to face this problem head on. And I have to say, in our meeting yesterday with Mr. Putz, I think we did just that. As I say, it was a very positive meeting. We feel really positive about the fact that the Minister has listened, he's heard your voice from frontline, from practice, and he was interested in what you had to say. So keep your eyes posted, look out, and hopefully this will not be the end of the matter. We took the report to the media. We actually were really pleased with how the media picked the report up. We managed to have interviews on Radio Foyle, Radio Ulster. We were on Good Morning Ulster, Lunchtime Talk Back with Wendy Austin, and Evening Extra. There was interviews on City Beat, on Downtown, Cool FM, and we were on the BBC News Line programme on TV, on The Breakfast Show. The report was also covered online in the detail on the UTV website and on BBC News website, and it was in the newsletter, the Telegraph and the Irish Times. So, I mean, it really was, the message was taken out there. I hope some of you were able to hear myself and talking and trying to be positive about social work. We actually are able to include a link to an interview that Anne did on Radio Foyle and an interview that I did with Wendy Austin on Radio Ulster. So they'll be available to click onto. So take a listen, hear us trying to get the message out there, and let us know what you thought. We were pleased that the media took on board the message actually that social workers were striving to do more, they wanted to do more, and that actually you in some ways were being held back by unnecessary paperwork. So it was a good day. We also have been sharing our findings with members. This is one forum. We're travelling far and wide to childcare forums across Northern Ireland. We are happy to come along to team meetings, to journal clubs, to any kind of forums where you as social workers meet. So please, if you think it will be useful to have us along, please get in touch. Our contact details will be available at the end, and we would be more than happy to make an appointment and come and meet with you. We're encouraging you and all the social workers that we meet to share this message with their colleagues. And we're also, on the 5th of February, launching the Northern Ireland Association of Social Workers Adult Services Survey. We've been very clear with our adult services colleagues that we're aware that a lot of the issues that are raised in the childcare survey are pertinent to them. There are some differences in terms of how those services are set up and organised, and there'll be particular issues, but we're keen to gather information and to hear how things are within the adult services world. So in conclusion, paperwork is necessary. We've been very clear to make sure that has been part of our message all along, that paperwork is a necessary part of good quality social work practice. But at the moment, it's disproportionate and it's unbalanced. The amount of time that you have to spend on paperwork far outweighs the amount of time you're able to take on doing therapeutic and preventative work with children. The fact that you're working an additional 20 to 60 unpaid overtime hours every month is unacceptable. It's unacceptable to social workers and it's unacceptable to vulnerable families, and we need to do something to make that change for you. And we want to see a sustained change to social work, not paperwork. We can't do it our own. We want you to download our report. It's available online. Please share it widely, share it with your team, take it to team meetings, have a chat about it over coffee, spread the message and help us get the word out. And if you have friends who work within the adult services world, encourage them to take the time, like you did, take 5 minutes, complete the survey and let us know how things are. And then we'll take their message as widely as we were able to take yours. And as I mentioned earlier, contact us. If you'd like us to visit, please do. We're happy to travel. We are happy to come and hear the messages that you want to share with us. And importantly, it would never do if I didn't get an opportunity to actually say join us. It's a message that myself and Anne and Susan share everywhere we go. We really want your professional organisation to be the strong, independent voice for social work, the strongest possible that it can be. So join us, be part of us, and make our voice even stronger, even louder, and together as the independent voice of social work, we can make things change for you for the best. Thank you so much for your time, and thank you for putting up with my slip-ups and the few mistakes that I made. I hope you've enjoyed it, and as I say, please give us some feedback on how you found it, and I look forward to meeting you on my travels out and about in the future. Bye-bye.